As with the anxiety disorders, one way to conceptualize mood-related abnormal behavior is by discussing clusters of observable criteria that seem to hang together. That is, patterns of behavioral and psychological experiences that cause emotional distress or interfere with daily functioning, and that are inconsistent with developmental, cultural, and social norms. So each of these 6 mood disorders can be thought of as falling into 2 distinct categories: depressive disorders and bipolar disorders. And we'll go through each one of these disorders and talk about the defining characteristics and some associated information. As we begin our discussion of mood disorders, it'll be helpful to define a few mood-related terms. Mood refers to one's emotional experience over relatively extended periods of time, so over days to months. Affect refers to one's expression of emotion in the moment. A helpful analogy is to think of mood as the season and affect as the weather. And one way to conceptualize mood is as existing on a continuum. And in the middle of this mood continuum is a pleasant, kind of averaged, balanced, warm mood that we refer to as euthymic mood or euthymia. And it's normal to fluctuate between euthymic mood and sadness and happiness within a day, within an hour, across the years, across decades, and to even spend prolonged and protracted periods of time experiencing sadness and happiness and euthymic mood. Sometimes when people become profoundly sad or profoundly elated, these mood states can interfere with life or cause emotional distress. And when that happens, we call these mood states at either end of this continuum depression and mania. And when people experience a set of symptoms or psychological experiences or a mood state for a discrete period of time, we refer to those time-limited mood experiences as a mood episode. So someone might have a depressive episode or a manic episode. We'll talk about the specific criteria for mood episodes in a moment. So mood disorders involve episodes of mood or spending a discrete period of time at one end of the other of this continuum. So a few days to a few months. And we can categorize those episodes as mild, moderate, or severe. The first disorder that we'll discuss is major depressive disorder. And the main defining characteristic of major depressive disorder is experiencing at least one depressive episode. And the criteria you see here on the left-hand side of the slide are the criteria for a depressive episode. A depressive episode is at least 2 weeks of either depressed mood or loss of interest or pleasure, and several of these other experiences, such as changes in weight or appetite, sleeping too little or sleeping too much, changes in motor activity, so either moving around and fidgeting a lot more than normal, or moving a lot less and speaking and moving more slowly than normal, difficulty concentrating, fatigue, feelings of worthlessness, and suicidal ideation. In this way, major depressive disorder involves acute, time-limited periods of depressive symptoms. And most depressive episodes, they have to last at least 2 weeks, and most run their course within 6 months. And normal euthymic mood then returns. It's common for individuals who meet criteria for major depressive disorder to experience recurrent depressive episodes as mood ebbs and flows across time. Sometimes depressive episodes are so severe that individuals with MDD will experience psychotic symptoms, meaning individuals are out of touch with reality. They might experience delusions, which are firmly held beliefs that are contrary to objective evidence, that are not changed by presentation of objective evidence, and hallucinations, seeing, hearing, feeling, or sensing things that are not actually present in one's environment. Individuals with MDD also experience negative thoughts about the self, future, and the world. For example, they might have thoughts such as, I am unlovable, the future is hopeless, and the world is a scary and dangerous place. Feelings of guilt, worthlessness, hopelessness, and helplessness are also common, as are suicidal thoughts and behaviors. Major depressive disorder is the most common of all the psychological disorders, and it's responsible for impairments in individuals' quality of life. And in fact, it's second only to heart disease as the disorder or illness most responsible for poor quality of life and disability worldwide. Women are at greater risk for developing the symptoms consistent with major depressive disorder than are men after puberty. Before puberty, boys and girls are at the same risk for developing depression. And we'll talk some and spend some time in class doing some applications about why that might be. There is a subtype of major depressive disorder, sometimes called seasonal affective disorder, but it's a specific type of major depressive disorder that follows a seasonal course in which depressive episodes are more common during the winter months. In general, it's important to remember major depressive disorder follows an episodic course. Most of the time, individuals who meet criteria for major depressive disorder might experience euthymic moods, and then across the lifetime will experience acute, time-limited periods of depressive symptoms we call episodes. This is contrasted with the next depressive disorder, persistent depressive disorder. Unlike MDD, this disorder is non-episodic, although it does feature depressed mood as the primary symptom. So the two defining characteristics of persistent depressive disorder are, number one, depressed mood for most of the day, for more days than not, for at least 2 years. And during that 2-year span, individuals to meet criteria for persistent depressive disorder cannot have had a 2-month period with no depressive symptoms. So essentially, this first defining characteristic means that these people are chronically experiencing depressed mood for an extended period of time across at least a 2-year span. And then in addition to that depressed mood, individuals to meet criteria for persistent depressive disorder must also experience 2 or more of the following characteristics: changes in appetite, changes in sleep, fatigue, low self-esteem, difficulty concentrating, and feelings of hopelessness. As I just mentioned, individuals with PDD are chronically depressed. The disorder tends to be very impairing and can lead to a life of isolation. So think of the character Eeyore from Winnie the Pooh, someone who exhibits the characteristics of being gloomy and dysphoric over a long period of time. So the course of this disorder is different than the course of major depressive disorder. PDD is chronic and not episodic depression. It's not necessarily a more mild form of depression. Sometimes the valleys, if you will, in mood can be less low than they might be during a severe depressive episode, but this disorder has a more chronic nature. A common feature, not a defining characteristic, but a common feature of PDD is rumination. And rumination involves cognitive activity focused on the past. You can kind of think of rumination as similar to worry, but focused on the past instead of the future. And rumination involves going over past regrets and mistakes in a futile attempt to try to figure things out or think things through. And individuals with Both MDD and PDD engage in high levels of rumination or unproductive kind of going through past mistakes and past regrets. So I'm now going to turn from the depressive disorders to the bipolar disorders, at the other end of the mood continuum. And the first bipolar we'll discuss is the aptly named bipolar I disorder. And the defining characteristic of bipolar I disorder is acute, time-limited manic episodes. And a manic episode includes at least 1 week of a distinct period of persistently elevated, expansive, or irritable mood, and increased activity or energy levels. So people need to have both of those for at least 1 week, and a few of these other experiences, such as inflated self-esteem or grandiosity, which involves inflated feelings of self-importance, experiencing a decreased need for sleep. Individuals during a manic episode will often go for several days and only sleep for a few hours without getting tired. So it's not only not sleeping, but not feeling tired and not feeling like one needs to sleep. Another feature of a manic episode is having a flight of ideas or racing thoughts, being distracted easily, and then finally excessive involvement in risky or dangerous activities, such as driving recklessly, engaging in risky sexual behavior, or engaging in excessive spending beyond one's financial limits. The third defining characteristic of a manic episode is experiencing severe impairment in social or occupational functioning or hospitalization as a result of the manic episode. So for someone to meet criteria for bipolar I disorder, they must experience a manic episode. And to meet criteria for that manic episode, the mania and associated experiences must be so severe that they cause severe impairment in social or occupational functioning. People must be unable to go to work, causing extreme impairment in their relationships with others, or need to be hospitalized. Please note that individuals do not ever need to experience a depressive episode to meet criteria for bipolar I disorder. The only defining characteristic, other than distress or impairment, is that people experience a manic episode, defined by these criteria here on the left-hand side of the screen. Most individuals who experience a manic episode at some point in their life, and thus meet criteria for bipolar I disorder, will also experience depressive episodes throughout the lifespan. And they might experience euthymic mood much of the time, and then episodes of mania and episodes of depression that meet full criteria for manic episodes and depressive episodes. But to be diagnosed with bipolar I disorder, people only need to experience at least one manic episode, although most also experience depressive episodes. Oftentimes, mania is so severe that it requires hospitalization because people might be at risk of harming themselves or others. People might experience psychotic symptoms while manic. Hallucinations and delusions are not uncommon. And individuals may also experience what we call a mixed episode, which involves features of manic and depressive episodes together at the same time. So this graph here displays a course of mood for someone meeting criteria for bipolar I disorder. So imagine that the x-axis here is time and the y-axis is mood. Now note that rapid cycling between mania and depression is uncommon. Manic and depressive episodes are often separated by months or years, not minutes or days or hours. So in this way, bipolar disorder is not the same thing as mood swings. We all experience mood swings. Bipolar disorder is different than that. It involves episodic mania and depression over the course of a lifespan. Severe mood swings are often signs of struggles with other sorts of difficulties and other disorders that might involve emotion regulation deficits. And we'll explore that more later in the semester. The second bipolar disorder we'll talk about is bipolar II disorder. And there are 4 defining characteristics of bipolar II disorder. The first is experiencing at least one hypomanic episode. A hypomanic episode is a less severe mood episode than is a full-blown manic episode, and it consists of a distinct period of persistently elevated, expansive, or irritable mood and increased activity or energy for at least 4 days, along with some of these other symptoms, such as inflated self-esteem or grandiosity, decreased need for sleep, pressured speech, having a flight of ideas or racing thoughts, distractibility, and excessive involvement in risky or dangerous activities. The third defining characteristic is that individuals must experience a change in functioning, but it must not be a severe change in functioning such that it causes impairment in social or occupational functioning or requires hospitalization. So again, hypomania, a less severe version of mania. And one reason it's less severe is because it's 4 days instead of a week. Another reason it's less severe is that it doesn't cause the same level of impairment in social and occupational domains as does full-blown mania, and it doesn't require hospitalization. And then finally, the fourth defining characteristic of bipolar II disorder is that individual must, to meet criteria, must have a history of at least one major depressive episode. The graph here on the right-hand side of the screen displays the course of a mood disorder for someone meeting criteria for bipolar II disorder. Again, the x-axis here is time and the y-axis is mood. Note the less severe elevated and expansive mood relative to bipolar I disorder, and again the requirement of at least once during the lifespan experiencing a depressive episode. The final disorder we'll talk about is cyclothymic disorder. And the defining characteristic of cyclothymic disorder is fluctuations between hypomanic episodes and depressive symptoms that don't meet full criteria for major depressive disorder. And the graph on the right-hand side of the screen shows the course of this disorder across time. Note the hypomanic episodes and the depressive symptoms that don't meet criteria for full major depressive disorder. So as with the other bipolar disorders, note that it's rare for individuals to rapidly cycle between hypomanic episodes and depressive symptoms, that these fluctuations occur over relatively long periods of time.